The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, a board-certified oral and maxillofacial surgeon, Dr. Ornstein. Dr. Ornstein, welcome to the program.
Glad to be here, Randy.
Now, as an oral surgeon, what type of patients do you see? I mean, what are the different categories of patients you see?
We see many different types of patients. Sometimes they're the patient with a single tooth missing, maybe from a sports injury. Kid playing football knocks out a tooth, comes in, gets a tooth out, gets the implant in the same day. We have patients, maybe they lost their dental insurance, they've been going around for years with neglect, maybe they're afraid, maybe they're in pain, and they come in to have those replaced. And more so lately, we get the patients that have been wearing dentures for many years and are not happy with them. Maybe they're having problems, maybe they're having pain, they're not staying in, they're falling out when they smile.
The dentures fall out?
The dentures fall out. Yeah, so they're coming in for the implants.
And so you do the surgical part of it. And does somebody need, by the way, a referral to see a specialist like you? I mean, do they have to get a referral from their general dentist, or they can just call you directly?
They can call us directly. Most people know they need an implant, especially the people that have become more educated about the implants where it concerns their dentures. They're tired of them falling out. They're tired of using all that glue to hold them in. And
do they tell you this?
They absolutely do.
Okay, so moving on to today's topic, dental implants, who's a candidate? What are the different categories that you see in your office?
There's a range of different types of patients that we see. Sometimes it's a single tooth replacement. It may be from a trauma, like a football injury for a kid at practice or something like that. They'll knock a tooth out, come in, get the tooth taken out and an implant in the same day. That's often possible.
So tooth in a day, by the way, is true when I see some of this type of advertising. On the right candidate, you can do it?
It sounds funky, but it's true.
Really?
Yes, it is.
All right. Okay, so you've got the one tooth, and then what?
Sometimes we have people with several teeth missing. Maybe they wore partial dentures for a few years. Maybe they need a few teeth out. We can do that too. And a lot of times it's people that have, for one reason or the other, not gone to the dentist for years. Maybe they're afraid, had a bad experience, maybe ran out of insurance. And those people are coming in and maybe they need all their teeth out. So a lot of times these days it's sad. It's a sad day when it happens, but it's true.
Do you think people put it off too long? They've either been told or they know their teeth have to go and they do nothing? I mean, is there a group out there like that?
I think humans by nature are procrastinators.
I know guys wait till the last second
for sure.
To do that
I hate
stuff.
to say that, guys, but it's true. And sometimes their wife is the one that went out and got all the information and took them to the office. We say that quite a bit. The women are the watchdogs of the health issues in the family. Then we have the denture wearers, the patients that may be new denture wearers. The upper dentures are a little better to tolerate than the lower dentures, and that's because you have the entire roof of your mouth to hold the denture in. The bottom denture is really pretty tricky, and it's hard to hold that thing in. Your tongue wants to kick it out. It's jiggling around. It's very uncomfortable. So sometimes people will go for maybe a year with a new denture and figure out, wow, I'm sorry I didn't make that decision to get those implants. So they'll come in and get the implants done. Okay.
Now, it's become pretty mainstream. Is that right?
It has. And some of that is thanks to the internet. People are becoming more educated. They're listening more to shows like this. They want to do better for themselves. We have the baby boomers are blossoming out there now, and they're all getting older. And people are living longer. They want to look better, feel better about themselves. And that's one of the main reasons they come in.
Yeah, now 70 is very young today.
Absolutely.
And that's about the typical age of your patient?
It can be. Unfortunately, I have some younger.
What if they have osteoporosis? You know, I've told this to other doctors, and my mother, 74 years old, says, Randy, you know, I don't care what you say, you know, I'm too old for dental implants. Her medical doctor said that they'll fall out, things like that. I mean, is that a common belief or a common thought? Because we talked and you said, no, that's a common belief. And, you know, that's an interesting question because, you know, why do people have osteoporosis? It affects their hips and, you know, sometimes their jaws. And the bone is different in the upper jaw than it is in the lower jaw. The upper jaw is typically thinner and softer. But here's the deal. If you don't have teeth in there, it doesn't have a job to do. It's unemployed. Okay.
And what does it do? If you're unemployed, you're going to get depressed. You're going to go away. And that's what happens with the bone. Once you put the implants in, that bone is in function again. It actually strengthens their bone. So one of the patients I'm going to show today actually had a problem with osteoporosis. And
Let's take a look. What do you have there? And you say it changes their lives. And I smile, because I feel like sometimes it's a bit of an overstatement, but...
Well, yes and no. And you smile, and that's the thing that we change the most.
Okay.
And funny thing about a smile, it's the Webster definition is contraction of the muscles around the face to show happiness or pleasure. Really, somebody said it better, and I forget who did the quote, but smile and the whole world smiles with you, and frown and,
okay.
you know the rest.
Okay,
so
good.
once you
good.
smile, you feel better about yourself, and, it's a whole upward curve from there. So this is a lady that came in with dentures. She'd been wearing them for many, many years. Not a particularly old lady, but she had lost her teeth early in life. So what happens when you lose your teeth? As I mentioned before, you lose that bone. She had lost so much bone that when she spoke, her nose actually moved. And
really? Okay.
yes, and the other thing is there's a nerve in the middle of your jaw, and normally it's protected by your teeth and your bone, but when you lose that bone, what happens? The nerve seems like it floats to the top, and what her denture was doing was sitting on that nerve and causing her pain, burning, numbness. So she was a mess.
So when you hear about denture pain, it is a nerve being exposed?
Sometimes it's just wear and tear on the gum tissue, and the bone actually becomes exposed. Or, with loss of the bone, the nerve is riding up on top. So it's like having a pinched nerve in your back, except it's under your denture.
Yeah, but isn't that what a reline is when they go to reline their dentures? Does that help or take that away?
Yeah, what it does, it tries to replace the bone that you've lost. But it's an artificial thing, and again, sometimes you end up with this big wad of stuff, and, you have a little, what we call a pencil mandible, and that's not a healthy situation.
So it's painful?
It's absolutely painful.
Okay, so with her, what do you do?
She was sort of a challenging case. Not only did she need implants, but she needed something into which to put the implants.
Okay.
So it's kind of like hanging a picture on your wall at home. If you hit the drywall, guess what? You can't hold any weight. It's not going to work out for you. If you hit the stud, you're in great shape. So for this lady, that's what we had to do. We had to rebuild her bone, and then she got 6 implants on the top and 4 on the bottom. This is the result that we got. This is like a whole different lady.
All right, well, she looks pretty happy.
So my son said, no, that's not the same lady when he saw the pictures. But no, this is actually the same lady, but a different lady. What's different about her? She can't stop smiling. This is the lady that deals with the public. And when she first came into the office, she didn't hold her head up. She was a little bitty lady, but her head was always down. And she never wanted to smile because she was worried her denture that was held in with about a tube of adhesive was going to fall out.
So with her, again, as a recap, what'd you do?
She got 6 implants on the top and 4 implants on the bottom. There's usually an option when you have this done. You can do a fixed appliance, which is something that kind of screws in, and we have a model of that to show you. Right. This lady opted not to do that. She was a little concerned about how to clean it, things of that nature. So she kind of went the conservative route and wanted to take them out every night and clean it because that's
snap
what she
in,
was
snap
comfortable.
out.
Absolutely. And for her, it was pretty life-changing. She actually started off as a little bit of a diabetic because all she could eat was mushy food that was not necessarily good for you. And after we put those implants in, she actually lost weight. She was able to eat much better, her health improved.
So you could eat chicken or a steak with these snap-in, snap-out dental implants, right?
You could eat anything you want with these, just because
like a corn on the cob?
Absolutely.
Okay.
And this is what that lady loves. So before, she definitely couldn't do that. She had to cut the kernels off the corn and eat them that way. But now she can eat anything she wants. And like I said, her health has improved because of it. Interesting factor, but...
Now, okay, so denture wearers will watch this program, things like that. And there's, what, thousands, you think, in Texas?
Probably.
100,000 in Texas, people that are wearing dentures. If it's as good as you say it is, why isn't everybody doing it? What is your take on that?
A lot of times these people just don't know it's available. Now, we talked about the internet and people finding out about stuff like this, but a lot of times it's the younger people. Maybe they'll think about their mom or their dad and say, Mom and Dad, I saw this thing on the internet, you think you want to go for that? And they'll come in and ask about that. So a lot of times they just don't know.
So the denture wearers just don't know.
Yeah.
Now terms like no more dentures, do you think that's the future of dentistry? Somewhere along the line that you'll just get your teeth back with dental implants? What are your thoughts on that?
I think that's definitely the trend. These implants are revolutionary. They really do change people's lives. Imagine if you can eat better. A lot of times people come in, they're old, and they think, well, gee, am I too old for this? Why should I do that now at this stage of my life? But why not?
Well, how old could you be to get a dental implant?
If you can walk still, you can come in if you're not, taking, and I'm going to qualify that. I was about to say if you're not taking a lot of medications, you can have implants, but we do have a lot of patients who are older that do take a lot of medications. Like in their 80s,
it's not too old for dental implants.
80s, 90s. I had a gentleman who was 91 and insisted on getting implants. His son-in-law was a dentist and introduced him to that, I think, 15 years ago. And now every time he loses a tooth, he comes in for an implant. Okay. 91 years old.
But what about the highly anxious patient? Just the fear of the dentist.
I think that's almost every patient that I see.
Okay.
Everybody that walks in is anxious, nervous, especially the patients that have been wearing dentures for a long time. Well, why did they lose their teeth? Sometimes they get a bad experience when they were a little kid, and they remember that. I had a 75-year-old lady that remembered what happened when she was 6 years old.
At the dentist.
And at the dentist, and she was just terrified.
So what, IV sedation? Is that what you're using?
For the most part, almost everybody is asleep for their implants. Nobody wants to sit there and get needles poked into them and stuff like that. That's what they hate about the dentist. I mean, let's be honest.
Yeah.
They come in, they don't want to get hurt, they don't want to feel any pain, they don't want to hear the noises. So it's a much more comfortable experience going to sleep.
I mean, is it true that they could actually say, I don't even remember you doing the procedure?
No, what usually happens is they sit there and they go, okay, I'm ready to get started now, but we're already done.
Really?
Yeah.
Okay.
A lot of times we're heading them out the back door and they're like, oh, no, wait, I came for surgery. I said, you already had it. It's
really?
time to go home. Yeah, it's great stuff.
Now, we're going to take a quick break, but make sure I get this correctly. This all-on-4, that's 4 implants for a denture wearer to give them something fixed in their mouth, a fixed set of teeth.
Exactly right? Okay. Exactly right. Back in the day, we used to think that you needed more implants to get this done. The thought used to be 6 on the bottom, 8, 9, 10 on the top. But the technology has changed so dramatically that we're able to do the same job with just 4 implants. And the way we can do that, the implants can go in straight in the front and we angle them in the back. And the whole idea is to anchor the whole mouth from front to back. And if you angle the implants and the abutments, then you've got the spread, you've got the stability. So just 4 implants will do it.
What's interesting, okay, it's good to hear actually from an oral surgeon that this is possible. Because anticipating this interview, I've had general dentists that say, Randy, I don't think so. I think you need 6 or 8 implants to give something fixed in their mouth.
Those are the guys that missed that physics lesson that one day.
Okay.
About the levers and the balance. But really, all it is about stability. Once you have what we call cross-arch stability, you can get that denture to go in and be stable. It's not going to rock. You can do it with 2 implants. And for a lot of patients, that's the option that they choose. Maybe it's a financial reason. Maybe they just don't have quite enough bone. They don't want to go through a grafting procedure. And the 2 implant option is a viable option. You just snap the thing in, snap
2
it out.
implants, snap it. And is that a big change? I mean, can they still eat pretty good with that?
Yes, I mean that's
a model right there.
It's a shocking thing. We have the model.
Let me see that.
Here's the model. I'm going to show that to you.
Okay.
Yeah.
So is this accurate? Yeah. Okay.
Yeah. See, it's pretty tough to get off, isn't it? Yeah.
All right. Okay. So 2 implants right here.
Just 2 implants. Those are little ball attachments. They snap on.
Snap out.
I had an 85-year-old gentleman. They thought he had cancer because he was dropping weight like a stone. Why was that? He couldn't chew his food. He was just bolting it. He was having stomach issues. He used to vomit. The guy was just wasting away. We put the 2 implants in. That's all his jaw could accommodate because of all the bone loss. Next thing I know, I get a picture of the guy. He's like gained weight. He can't stop smiling. He's taking the pictures with the waitress at the Hooters restaurant. So it changed his life.
And they show you these pictures.
They brought the pictures. His daughters became patients of mine, and
because they could eat again.
Yeah, he was so happy.
So, is there such thing as a happy denture wearer? I mean, I know a few people that have dentures. I never hear them complain about it at all.